It's time now for The Opinions Matter, a look deep inside the local issues, events, and policies affecting the Mercer County residents. Here's your host, Joe Fabrizi.
Good afternoon, and welcome once again to another hour of Opinions Matter. Today, we're very fortunate to have in the studio live a representative of the Medina Health Center, Mira Sadeghi. She's the General Operations Manager. Mira, thank you so much for taking some time out of your schedule to come in, you and your colleagues. And you do have two other individuals with you today that are going to help answer some of our questions and to better inform the public on what your organization is all about. Would you care to introduce them, please?
Thanks so much, Joe. So with me today I have Nabeel Khan, our Development Director, and Captain Hakim, one of our esteemed board members and community outreach representatives.
Hello, everybody. Good morning.
Okay, and welcome, gentlemen. So let's start out a little bit about first of all, Medina Health Center. How long has it been in existence?
So as an organization, Medina Health Center came together in 2014. So we're a little over 10 years old now. Mm-hmm. Originally, the health center started as more of an Uber model, we like to say, of specialty care. So we had volunteer specialty care physicians throughout Mercer County that wanted to give back to the uninsured community, and they would see patients pro bono throughout their normal schedule in their own providers' offices. We saw over time that less and less physicians had the freedom and ability to donate their time to the uninsured. And there's also a growing need for primary care in Mercer County in addition to specialty care. And so in December of 2024, just a few months ago, we finally opened our first brick-and-mortar facility where we're now offering full-time primary care to the community. And we're also continuing our Uber model of specialty care with our network of specialty care physicians as well.
The brick-and-mortar facility there, how was that funded?
So all of our funding comes through grants and private donors. We don't have any sort of federal funding at this point.
No state funding, no county funding, no money from anywhere else except private sector.
Correct.
That's interesting, and that's rare with nonprofits today. So let me ask you this. Are there any financial thresholds when people apply for the service? I know you serve the indigent, but at some of the other programs, government programs, if you have a certain amount of money, you're disqualified. Is that the case with your organization or not? Excuse me.
At this point in time, the forefront of our focus is on accessibility and being as low barrier as possible. So we're a very no questions asked type of facility. If someone walks in, it doesn't matter who they are, where they came from, what's in their wallet, we'll see them for free. That's our goal.
So, Mira, when you say where they came from, I can envision in the future you're liable to have people coming in from out of state at some point if the word gets out. So at some point, I would think they're going to have to restrict services in some way. I don't know how, but is that that's a reality, don't you think, or not? Yeah. I know you don't want to restrict it, right. But until, if you can't grow quick enough, what do you do?
So at this point, being a free health center and having the funding model that we have a lot of flexibility to serve who we want to serve. Mm-hmm. And so once more funding comes in from different places, different grants, different people, different levels of the government, that's where the dollars tend to get more restrictive in who's allowed to benefit from that money.
So a lot of strings come with those grants.
Yes, of course.
And right now you're not restricted at all. It's kind of nice.
Yeah, it's great. It's great.
So that's probably one of the differences between a federally qualified health center. But in many cases, they have a similar mission, do they not?
Yes, I would agree with that.
So the only restriction would be then is the strings that come attached with the money.
Yes, so federally qualified health centers typically offer a sliding fee scale for patients that are uninsured, and they'll accept insurance reimbursement from insurance companies for patients that are insured. Mm-hmm.
So let me ask you this. What's the most common service that you provide?
Primary care, which is a pretty blanket term for a lot of things.
Okay. So what other services do you provide?
So I guess I can kind of delve into what primary care entails for people who are less familiar. Essentially, we are the first stop or the first point of contact for someone who needs access to the healthcare system. So whether they're healthy and they just need a checkup, they haven't had blood work done in, decades in some cases, to get a pulse on what their health looks like. We do a lot of physical exams for people who need that certification for working. Mm-hmm. A lot of workplaces require things like a tuberculosis testing and a bill of good health from a provider. So we offer that to a lot of residents, and we also manage a lot of chronic diseases. So things like diabetes, hypertension.
Okay.
We have a lot of patients that come back to get their medications refilled, that type of thing.
So basically you're saying it's preventative medicine in a lot of instances. However, you do other things as well. So let me ask you, somebody comes with a pain in their side and they find out they have cancer. Do you take care of them? And where do they go afterwards? I mean, obviously at your facility, you don't have the capability of treating cancer patients. So the next question is, who are you people affiliated with?
Mm-hmm. So when cases get more complicated, we would hand things over to a specialist. Mm-hmm. So in the case of cancer, thankfully Medina is partnered with an oncologist that offers pro bono care for uninsured patients. Mm-hmm. And so we can schedule an appointment with that oncologist to do what needs to be done in terms of diagnostics and treatment.
Right. But how about a hospital, though? So now they got to get to a hospital. How does that work? Yes.
So the hospitals in the area all have what's called charity care for the uninsured, which is sometimes a lengthy process. There's a lot of due diligence on their end. Right. And it can be quite burdensome for patients in some scenarios to get together the required paperwork and that type of thing. Mm-hmm. But those are the systems that we can help the patients navigate to make sure that their care does get covered at a local hospital.
Mm-hmm. And some of the professionals that are involved, you have nurses involved as well as physicians, right?
So our on-site facility is strictly primary care. We have one full-time nurse practitioner, Dr. Tinwaya Mera. And then we've got a front desk woman. She's also a medical assistant, so she handles a lot of the clinical care as well. And we have a fairly small team for now, but things are certainly going to grow over the next couple of years.
So, and these other physicians that are linked with you, about how many are they? How many people are involved altogether?
We have around 25 specialty care physicians that we work with currently.
That's impressive.
Yes, it's a long-standing relationship.
And how much time do they actually donate of their time? Because their time is valuable.
Yes, definitely. It depends on the practice. Some have a little bit more free range in how much they can give time-wise. Others are a little bit more restricted by their employers. For example, in November of this past year, I believe we did around 20 colonoscopy procedures.
Wow.
So it really depends on the practice, but there are certainly physicians in our network that see tens of patients every single month for years.
What about rheumatology? Do you have that too?
Yes, that's one of our biggest specialties.
Wow, and you have a doctor that's affiliated with them?
We do. Dr. Kaisar Usmani is our main rheumatologist.
Wow.
He's an incredibly generous man, and we're very grateful to him.
Wow. Podiatrist? Do you have a podiatrist?
At this point, we do not have a podiatrist, no.
Okay, so I hope there's someone out there listening. Maybe we can get one to volunteer.
Yes, please do reach out.
At any rate, there's many things that are that you people have been able to accomplish, and we talked about how you got started, but who were the people actually that got involved in the beginning that said, listen, this is something we need to do? Who were they?
I'm going to pass this question off to Captain Hakim, who's been with the organization a little bit longer than I have.
Yes. Okay, yes. And your question, Could you repeat your question? His question.
Who was originally involved in the genesis of Medina, and how many people are on the board?
Yeah, we have on the board. We have like 15 people on the board, and it all started with Sajid, who's the chairman of the foundation, chairman of the Medina Clinic, and as Mira has indicated before, he is a by trade he is a pharmacologist, okay. And basically what he did was he got some physicians together, right, to create a Medina Clinic, and they all had a common ground. The common ground was to help or to serve people in an area such as the city of Trenton that lacks adequate health care.
Right. But, it widened. Besides the city of Trenton, it's open to anyone now.
Well, yes, and pretty much it's always been open to everyone, but primarily because of the limited staff and pretty much like it was a grassroots organization compared to where it is now. It's Mary indicated, starting off with grassroots, right, and now we have a center now, right, a physical location.
So let's talk about the physical location. How large is it? What's the square footage of it?
Oh gosh, I mean it's around
6,500.
6,500 feet. Yeah.
6,500 square feet.
It's a very large facility. Well, let's say it like this: we have non-examination rooms, conference room.
Right. So you have a lot of things going on there, administrative as well as exam rooms and what have you.
Yes.
And what was it? Was it a former building? Is it a new building? What was it? Was it something that was retrofitted?
No, actually, it was a health center previously. No.
Yes. So during the COVID era, the city of Trenton had rented the space out, and they were doing COVID vaccinations and testing out of that site. So it was kind of outfitted as a clinic before we moved in.
Oh, which was pretty neat. That was good. Didn't have to spend a whole lot of money retrofitting it.
Well, believe it or not, we did. And I think because of the services that we are providing now, as Mira mentioned before, what we have, it was the city of Trenton used it for COVID testing,
right,
back in that time.
Right.
But now, since we're going to use it as a clinic, we've had to spend a substantial amount of funds to bring it into compliance with the state health regulations in terms of becoming ambulatory care.
Yes.
It's the standard amount of money.
And there's also a lot of things that had to happen under the Department of Community Affairs (UCC) laws, right?
Yes, indeed.
Yes,
which I'm very familiar with, by the way.
Yes, and we all know what those trials and tribulations.
Well, you know what? They're necessary, though. It's about human safety.
Yes.
And a lot of times people want to put dollars ahead of safety, getting people out in case of a fire and what have you.
Yes.
And there's people who can't see. There's people who can't hear. So, there's Braille, exit signs. There's all kinds of things that people aren't even aware of. Every day people said, oh, well, we got to have that too. How much does that cost? Well, it costs. There's a cost factor in everything. And I'm sure you people were faced with all that. And but you survived.
Yes.
You survived.
It was a long process, but we just last week got confirmation of our ambulatory care license through the state. So that was
there you go.
Exciting.
That's good.
Yes.
That's great.
And it's a beautiful building. It's a very beautiful building. For someone to come in, I think a lot of the clients, when they come in the building, they think that it's going to be like a hole in the wall, or so a lot of times when you're treating people that are in need. Yeah,
you kind of think of some place that's probably right, and that's not the case. I got it. I got really what you're trying to say.
Beautiful establishment. I have to say so myself.
Yeah, that's good. That's great. That's good news. Hey, listen, we came up on a break, and we need to spend a little time here with our advertisers. We're coming back right after this. There's a lot more to hear about this Medina Healthcare. Stay with us.
We now return to Opinions Matter, a look deep inside the local issues affecting Mercer County. Once again, here's your host, Joe Fabrizi.
Welcome back. We do have an interesting guest today who represents Medina Healthcare, Mira Sadeghi, and she has a couple gentlemen with her that are part of her organization, and they've been helping answer some of the questions that I have. And I just want to open this up to the public. If you have any questions about this organization, these three people here are very knowledgeable about the way this operation works. And you can call 215-949-3232 to ask any questions you may have. So one of the questions I have is, throughout Mercer County, are there different areas of need throughout Mercer County? As let's say Trenton, Hamilton, Princeton, maybe Princeton not so much, but also the different medical requirements, like, coming from these different areas. For instance, you treat drug-related problems as well. Is that something that you handle, or is that something that goes to another organization? Anyway, there's a bunch of questions that I asked in one. So we have a panel here, and once again, I'm going to ask you, if you don't want to answer them, to defer to your colleagues and introduce them as you do so.
Sure. So to answer your broader question, there's a lot of different needs among different communities, and Mercer County specifically has a pretty large wealth disparity between, the top earners and the bottom earners. And with that wealth disparity comes different health outcomes. And we know in public health that health is very much tied to wealth and instances of chronic disease.
So let's stop there for a moment and break that down a bit. Why, Mira? Why? It's because of the way they eat, the things that they eat?
Definitely. There's a lot of reasons for that, and I'm sure we could talk for hours about it, but it really boils down to what a community has access to, whether that's grocery stores that sell affordable produce. Trenton's a food desert, meaning there's not enough grocery stores, so a lot of people rely on fast food or corner stores to get their dinner, to get their meals.
One of the things that I've noticed, though, I think it's... what is that? The gardens? What is that called?
The community gardens.
The community gardens, and who's behind that? Isles, right? Okay, another nonprofit.
Yes, they do great work.
Okay, and they started out with gardens, and I know some people that were involved with some of the other groups that were taking that produce and distributing it, and some of those people did not want it because it wasn't cooked. Now, what does that tell me? It tells me that they're not getting the right information from government or from government leaders, basically, to make them understand that this is something that's good, it's being provided to you at no cost, and yet you don't understand, there's not an understanding of why it's good for you. So there's where I see, and I don't know if you agree with this, but I need to say this at this point, there's an absence of a government intervention in that aspect of it. It's not just giving people things. You have to tell them why and why it's good for them and why they're getting it, to make them understand and not reject it. Say, well, I want something that's cooked and ready and prepared.
Definitely. I think education is important, and education about nutrition and being healthy is something that we could improve on as a society.
Right. And it's diet and exercise is a big one.
Exercise, yes. And when it comes to, handing someone some fresh produce, we also have to consider time.
Do they know how to cook it? Do they know what to do with it?
Yes, not just the knowledge, but also the time, because it takes a significant amount of time to prepare a meal for a family, and it costs a lot of money if you're buying all of those ingredients from the grocery store. Maybe not everyone's working a 9-to-5. A lot of people in this area work in the service industry. They work evenings or early mornings, and they have children to take care of, and there's so many factors that make living a healthy life difficult. And so that's why our main goal is to reduce the barriers to at least getting primary care. And when it comes to things like substance abuse, we don't want to reinvent the wheel. So I'll let Nabeel, our Director of Development, speak on some of our relationships with partners we have in the community in that sense.
Thank you so much, Mira. So essentially, like Mira said, we don't want to reinvent the wheel, so we are sort of linking up with organizations. We've had communication with the Mercer Council that does addiction and opiate recovery, and we are looking at other organizations, and we'll see what way we can refer these organizations. But because of the fact that we become the first line of trust, because if you're going to take somebody through that process, you need to build that trust first.
Correct.
So I think that is what we are doing. That is our purpose in the community, to build that trust with the individual, to say, we are going to link you up with things that are beneficial for you.
Yes.
But when they will see that benefit for themselves, that is when they will really be, sort of aligned with what we and our partners want to do in this area.
So the soup kitchen is one that brings people in, as you said, and it gains trust. And then if they need help, they don't push them, but if they reach out for help, then they get directed to the different areas where they can get the help that they need. Is that correct?
Yes, absolutely.
So the soup kitchen is one of my things that I donate to, actually, and I've had people from the soup kitchen on here on a couple of occasions at least. And I think that's something, no one should go hungry.
Sure.
No matter what their financial background is.
Sure.
And what's kind of unique about the soup kitchen, sort of like your outfit at this point, I could walk in tomorrow, I can go down there to this evening, and I could have a dinner there.
Yeah.
And they don't ask, hey, why are you here?
Yeah, that is true. But the one thing that I would say about healthcare is slightly different, is nobody saves up for healthcare.
True.
People do save up money for food because that's an immediate need.
Yes, that's an immediate need, right.
Healthcare can come down the road. So a lot of times, a lot of our patients, when they come in, they have delayed their thing for such a long period of time that it could have been caught earlier and could have been dealt with earlier. So it was more preventative now than to actually have to cure it.
So do you agree education is an essential part of delivering the healthcare needs, preventative medicine?
I do agree. Education and access is very important. Look at the population of Trenton. It's about 90,000 people, right? But if you were to look at existing hospitals and facilities, they only do about 40 to 50,000. So
I don't think it's 90,000 anymore. I think it's probably around 70.
70, I think.
Okay.
Yep, I think so. But I think also just to mention what Mary's talking about. It's great that you picked up on the food situation, because we partner with right now with just about every organization,
right?
Because we have like a common ground.
Sure, you do.
Just about every organization out there. All of them have services, and people, their clients need health care. So we're really working really hard in connecting with everyone. Catholic Charity, the Trenton
Lutheran Ministries. All of them. Right. I can go through the whole gamut. As I said, I worked
we haven't left one stone unturned that doesn't know anything about Medina Clinic right now.
Right.
But I think one of the points I wanted to make is that healthcare is not an option. And it was funny. It's great that you brought up the food, because believe it or not, we work with tasks. Okay, but also through another organization that we work with, called the Muslim Center of Greater Princeton. Greater Princeton, we also provide meals every day to the people in Trenton.
Right.
So we work in conjunction, sort of with task. But we work independently. We kind of do the same thing, but we have meals on wheels,
right,
so to speak. And we have a group that goes out in the truck and provide meals in the community to the senior citizens, to the people on the street, getting to the people that really need the food. The guy that's on the corner with the sign that says "Help me," looking for money and things of that nature. People that are on the corners, and this is what we are. We are considered like boots on the ground. This is something that no one else is doing. Not the Henry J. Austin Health Center.
Right.
No one is, I think, going as far as like boots on the ground as we are.
I tend to agree with you, to say the least. And I think that you're right. And I think it's a need that needed actually, to play on words, that needed fulfilling.
Yes.
And so, I think you're providing a great service to the community, to the greater Mercer County community at this point, right? Even, as anyone can walk in there at this point. Unfortunately, I see the future is coming, at some point, when the word gets out, that at some point there's going to have to be some kind of a restriction of some type, whether, because you can only serve so many people at once, unless the organization catches on and it goes beyond Mercer County. Now, that's really what we're looking for.
Yeah.
Well, I think that's going to happen inevitable. That's automatic, because as we grow, the number we have doctors that are really beating on our doors to get in, to be a part of it.
So instead of, like, say, Mercer County, it would be Central Jersey, let's say, something to that effect.
I think at this point in time, the whole point is to make something that is really sustainable. To build
in the future going forward.
And we do see like something like Medina being in different places and sort of serving the needs of different communities.
Right.
And what is needed is something that you build a promise for a community and then you're able to scale it out.
Yeah, so maybe like now we're in Mercer, let's say we have a brick and mortar, but maybe a brick and mortar in Burlington.
Yes.
Maybe one up in Middlesex.
Yeah.
Because we're actually building a model. We will be able to take this model here and pretty much go to any city across the country and just give us a building. and can set up, and we can bring the doctors together. We can bring the organizations together, because pretty much in every urban town you have the same organization, all anti-poverty programs.
And something that I think everyone here agrees with, and all my listeners out there, if we keep people healthy, that's going to keep the cost of medical treatment down, and the cost of prescription drugs down.
Yeah.
So everyone benefits. No one loses with something like this.
Right.
And that's really important to get out there today.
Yes.
And people need to understand that. And I don't think anybody would disagree with me. If they did, I would challenge them to call and tell us, because tell me where I'm wrong about that. I don't think anybody could.
No, there's directly a link between physical and mental health. If you're doing well physically, you'll do well mentally, and vice versa. If you're doing poorly mentally, your physical health will also suffer.
And I could connect the dots with that. Now let's go to crime. If you're mentally okay, a lot of crime comes from people who are, when I say unstable, I don't mean unstable that they're out of their mind. Unstable in the sense that they don't understand reality from fiction, that kind of thing. So it all the dots are connected here. Anyway, time is flying. We have to take another station break. We'll be back right after this. Stay with us. Welcome back. If you just joined in today, we have some interesting guests here today. They are with the Medina Health Care organization, and we're going through some of the services that they offer the greater Mercer County area, actually, at this point, and what their future aspirations are. And I'm going to ask Mira Sadeghi what she thinks, or what they're doing right now besides, a show like this, and I'm sure their interaction with other organizations. But what are they doing going forward to publicize, to let people know where they can come to get some help?
Thanks, Joe. So, getting in the press is, of course, one way that we can reach a large audience at once. But what we're finding, asking our patients that come in every day how you're hearing about us, it's mostly word of mouth. And so our goal right now is to give patients a really great experience so that they're comfortable referring their friends and family to come see our provider and our team of doctors, because healthcare is something that requires a lot of trust. More so than a restaurant recommendation. You want someone that you can really count on to listen to you and to hear what you're going through and take all of that into consideration with prescribing medications and blood tests. And it's a pretty serious thing. So helping just build up trust with the patients we have, I think, is going to be our biggest motivator to get new patients in the door. But of course, going with the press, and we're hosting organizations almost every single week that serve similar clientele, so that we can educate them about what we do and how they can get their clients in our doors, so that we can help them with their healthcare needs if they're being served food elsewhere or another type of resource, for example.
Right. So the organizations that you're connected with, that's a resource. But going forward, and before we even answer that question, how many people come through the door on a daily basis right now in your organization? I mean, I wouldn't hold you to an exact number, of course, but roughly.
Roughly, we're seeing 6-ish patients a day, give or take. Some days are slower than others, but we did just open in December, and we have not done very expensive advertising campaigns at this point.
Right. But going forward in the future, there needs to be probably more vehicles to in terms of advertising to get people in, I would think. So maybe these gentlemen have some ideas on that. I don't know.
I mean, so we're doing different things. We are reaching out to the community in different events. We recently went to the Trent Center, which is like an assisted living community, and we sort of shared our services. So we do foresee, like, as we are reaching out to different organizations which have a clientele, like reaching out to TASK and probably looking at different points where we can do joint campaigns, where there's already a captive audience and you're sharing. We're going to different career fairs and stay, in the community, so that people come to know about our services. And once they get the foot in the door, then more and more people will arrive. But at this point in time, like we said, we opened in December. So our point was getting things correctly and getting the right experience is why we didn't want to take on too many.
Get it up and running. But going forward, go ahead.
Just as he said, I'm going to always fall back to boots on the ground. I'm always going to fall back to boots on the ground because that's pretty much how we are right now. Kind of like not paramilitary, but thinking in those terms. Because we're going into Trenton, which is a community. That you really have to. I say boots on the ground. Everything's against us. Job, education, social services. We are where the need is. So we have our work cut out for us. And as Nabeel said, we are connecting with different organizations. As he said, the senior citizens,
the 4 Cs meeting.
The 4 Cs meeting. And something such as the 4 Cs meeting, those organizations such as that is comprised of just about every nonprofit in the city of Trenton and beyond, including we have what we call the Street Team in Trenton, which is a organization that deals with street violence. And if there's a situation and the police, they work with the police to resolve situations. But the point I'm making is that we are working on the grassroots. We're not so much trying to reach out to the higher people. We need people that are in the grassroots, people that can get into the projects, people that get into the low developments, people can get to the corners, people can get to the corner stores. And that's that, because that is our audience.
One of the things that I'd like to point out, and I think we mentioned it earlier, the demographics are changing throughout Mercer County. And having been a housing rep for DCA,
yes.
And I visited a lot of these complexes in Hamilton, and I could tell you from firsthand experience, some of those people are right there, and a lot of times they're on the cusp there of their financial what they have coming in financially that eliminates them from a lot of these programs, and they need to have that kind of health care. So what I would suggest, the senior center in Hamilton, of course, there's some people that are there, it's a senior center, and there's some people there that are financially well off, but then there are others there that are probably not. Yeah. But don't discount Hamilton at this point, because there are a lot of people moving into Hamilton that aren't so well off as well. Hamilton is one, and I'm sure Ewing and Lawrence and the others. So I'm not saying that Trenton probably, as you said, there's a lot of problems, and there's a mayor down there that's doing a pretty fair job of trying to get things back in order, and the council, and there's a whole bunch of people on the staff that are trying to get things back on line there. But
I do agree with you in terms of, I think maybe I should have expanded that in terms of as far as like health, as far as senior citizens. No, we're not just going to, with senior citizens, we're not just going to be Trenton.
Right.
That, because as you said, there's places out there at the Lawrence Center out there on what's that in Lawrence. It's in Lawrence, but because there's people there that have various incomes.
Right. Exactly.
So we will be
things
reaching
have
out
changed.
to them.
Things have changed a lot.
We definitely will.
And what's so critical is the fact that if they earn, let's say, if they earn $21,000, over $21,000 a year, they're kicked out of all these programs, all these federal programs. And that's like, come on, at this day and age.
I'll also give you another example. You look at it from the point of a perspective of funding, right?
Right.
So there are different corporate organizations that are willing to sponsor, grants for organizations that are doing something social good. So when we apply to places, we look at Hamilton. We look at all this.
Oh, you're getting your picture taken, but that's okay.
Okay. So when we, sort of apply for all of these different grants, most of these organizations are you in the captive area of the organizations? It's a bank, it's a Walmart, it's something like Big Lot. So you're always looking at, you don't see it yourself yet, I'm 2 kilometers away or 2 miles away or 5 miles away, because healthcare needs, we've had people coming in from New York, from parts of Pennsylvania.
Right.
So
it's opened up to everyone now. Yeah, that's
so
good.
So we've not asked any questions where you come from. The only questions we do ask is purely from the perspective of, if we say that we're going to target underinsured and uninsured people, how many of those people are we actually targeting?
But in terms of getting the word out, besides word of mouth, and that travels pretty well, and that's the best advertising, by the way, whether you're a contractor or anything else. If you do good work, word gets around. If they give good care, the word gets out. So that really works well. But what about a Facebook page? Do you guys have a Facebook page?
Yes, we have Facebook and
Good.
Instagram. We don't have anyone doing full-time social media at this point, but we're hoping to get more long-term volunteers on
one of the volunteers that could
on
stay
the
there,
team
that
that
have some
can
time. What about the community pages? Like there's different groups. I think in in Trenton. I think it's Trenton Orbit is one.
Yes, I just discovered that recently, and I did make a post about our health center and what we're doing in the community.
Then there's Mercer County Concerned Citizens. That's another group that's out there, large group.
And the Trenton Downtowner. I don't know if they still do. Trenton Downtowner.
There's even in West Windsor there's a group. I'm trying to think of, but there's a bunch of them out there, different towns and what have you. So those are all things that are low cost advertising. You get the message out there. I do want to remind everyone that they can call in to ask a question. Normally, people like to listen. And I don't know why. I guess Bill could probably expand on that a little bit, but he's being silent today.
Silent minority.
Why, Bill? Step forward a minute.
Okay, I'm here. I'm moving in.
So,
we got him.
Why do you think people just listen in many cases and don't want to be part of the discussion? Why is that? Why do you think that is?
Well, it's not shyness. I'm pretty sure that people that we know that listen that I've heard, they're not shy at all. But I think a lot of people are. Well, first of all, I think they like to hear what you're saying, what the visitors are saying. But they're also afraid that they're going to be heard and might be identified and retaliated against, because people are afraid today to say what they feel and think. But when you have an environment like this and you've got this topic, I think it's so very important that everybody understands it and can share in that. One thing I remember from economics, I mean, I had economics at Mercer County Community College. The only thing I can remember from Dr. Boyle was when you take the food out of the belly of people, they become killers. And I think one of the things we don't realize, but you have to enhance it. Today we have such advanced medical facilities and treatments, and we're not considering that health as part of the important basis of what we need in our society. And I think that's why if more people would call in or just stop listening and start talking, they would understand and really participate in making this initiative value.
Right, and make it happen.
Make it happen. You got to shake the tree.
Yeah, that's what you have to do. So people out there, if we want a better community, you're going to have to help build it. And by staying silent, that's not going to get it done. I mean, if you don't feel comfortable on the radio, at least pick up the phone and call your legislator, your councilman, or your councilwoman, and let them know. These are things that we need. We need to inform the public about how important it is to take care of yourself, to eat right, to go get checkups, all that stuff on a regular basis. And again, it benefits everyone, even these people out there that are a little better off, that are in the upper end of the economic scale. It helps them because it helps all of you people at that end, because it's going to bring down the cost overall of healthcare in general and prescription drugs. Mm-hmm. So it's very important to our society.
A healthy body over a healthy mind is what they say, right?
Sure, yeah, very good. And once again, we've got to take a quick break, and we're coming back right after this. Stay with us. Back, we're wrapping up the hour here with a bunch of guests here from Medina Healthcare. And the question that I'm going to ask at this point is, how can people contribute in terms of money, in terms of time, and in terms of areas of expertise? So there's 3 categories there. And also I'm going to ask if there's any kind of an internship being offered with any of these colleges, whether it's a medical college or I guess the other term would be social service, those kind of categories. And so I don't know who wants to begin.
So our biggest need and our ask every day is for funding. We're not getting reimbursed for the patients we're seeing in any way. So if anyone is willing to help out financially, there's plenty of ways to do that through our website, medinahealthcare.org. We also have a Venmo, Medina-Healthcare, as well, for people who like to donate a little more casually. And there's a lot of ways to get involved with what we're doing. So we're always looking for physicians that are willing to donate some time.
How much time? Like what's a limited amount of time that they could give? Like the small, so it's worth it for you and it's worth it for them.
It depends. So if someone's willing to come in to our practice and become one of our providers for our patients, we'd be looking for maybe quarterly engagement to run a specialized clinic.
Let me ask you this: Can they could they write it off on their taxes?
Sure, absolutely.
Wow, now that's a little bit of an incentive.
Definitely. It's great. It's rewarding work. No one that is involved with Medina regrets being involved with Medina. It's a really good feeling to give back to your community and help the people, help your neighbors, do something that, a lot of the patients we see haven't seen a doctor in their entire life.
Sometimes a lot of people, like even myself, are actually guilty of, somebody said, or one of my physicians that I see, and I'm not going to mention his name, he said, "Are you allergic to doctors?" I says, "Well, I'm here today." He said, "Yeah, that's because you can't breathe anymore." And so we're all kind of like that, to some degree. And it really wasn't because of that. It was because of COVID and this and that and the other. And because I have so many things going on at once, and I'm still active, as you see here. And also I do, and full disclosure here, I do work part-time for the city of Trenton. So, I'm an active individual, and, having, getting up in my senior years, let's say, and I'm not going to disclose how old that is, but I do have some issues. And sometimes the issues are, well, wait a minute, I'll get to that. I got to do this first. But really I should prioritize that like everyone else, right?
Yeah.
So we all do that. And I'm sure everyone sitting here at some point might have done that. Hey, I'll make that appointment, but I got to get this done because it's got to do with finances. So it's got to do with somebody coming on the show. I got them scheduled for that day. I can't miss the show or whatever. Like Wednesday, Bill's going to be sitting in for me because I have an appointment with the heart doctor, you see. So I can't, they found some things there and I can't overlook it. Maybe it's nothing, but maybe it's something. Yeah. So I have to take the time out. So that's a good example of what we're talking about here in terms of even people that know better sometimes don't do what they're supposed to do.
I think competing needs are something that everybody, even in Trenton, faces as well. Like, taking care of the kids, having to cook food, looking out for a job, and then the costs. So that's why sometimes people are
the car breaks down, the car's got to go in for service, the car's not working, I can't get a ride, all that stuff.
What are you going to prioritize?
Yeah. So, where do you go first? That's what happens.
Yeah. Well, we have a great cardiologist for you to see if you want. Okay? And you can save on your money and things of that nature because he will see Dr. Mustafa.
Yeah.
We'll see you.
Well, I don't doubt that he is, but I've been seeing this guy, and for now, I'm going to stay there. But you never know. I may go for a second opinion.
There it goes. And it costs you nothing, right?
Cost me nothing.
But I think really, when you get right down to it, what I see is, I see a lot of doctors, right? I think they really want to give back to the community, right? But they don't have the contacts to get to the people. Mm-hmm. You know what I mean? Because you can have a practice in Princeton, and in your heart you want to give back to the people, but the people that come to your door are not the people there. So how do you reach out to them? You can reach out to them through coming through. So we make a space for any doctor that wants to give back to the community, wants to reach those particular.
Let me ask you, how many hours, like a 4-hour donation, would that be something that's?
I say sometimes, maybe
1 day a week, or
not, maybe 10 hours a month.
10 hours a month. That's not too much.
No, that's not much. That's not much, or less than that. But maybe 2 hours a month.
So I don't know what a doctor earns per hour if you break down what their earnings are, but it's probably a big donation.
Definitely.
But they can do a write-off, though, from their taxes. I mean, Bill, the tax man here, he knows about that.
I just entered a Torah tax or the other one and see what it comes up with. One of the things I had a question that I'd like to bring out, Mercer County Community College and some of the other, and a college in New Jersey is right here in the Trenton area, and they have nursing and social services. And I know some of the colleges will give a program where you can go out and you can earn college credits by going out and do a program, even if it's a short period, maybe a couple of weeks, they'll give you credit for it. Is there anything like that was reached out, or you had reached out to, or the colleges reached out to you?
It's strange to mention it because I had a student that was interested in nursing. I had a meeting with her in my office, and she had attempted to attend nursing school, previously, but she wasn't at the time mature enough or whatnot. Anyway, my conversation really led to her to get her back on the path of getting into Mercer County Community College. And just through our connections in terms of what we're saying in terms of, again, boots on the ground, attending the CCC meeting, I connected her with the director of curriculum from Mercer County Community College. At that time, she was at the meeting, they talked, and she left with that, with the administrator, and went back to the Kearney campus. The Kearney campus, she actually got her records back in order, gave her the transcript, and she then proceeded to have her paperwork to get back into Mercer County Community College. So
nice.
Those are the type of things that we're also doing. So we're not just, doing just the medicine thing, but we reach out to anybody that really needs help.
Yeah,
and she's on her way.
At the health center, we do currently have a intern from TCNJ. She's a public health student, so she's receiving her internship credit with us. So if there's any interested students that want to get involved in healthcare, administration, more clinical things, we have nurse practitioner students with us as well that are precepting with our provider. So we're always looking for ways to get people involved in our mission, whether it's through learning with us or doing outreach with us. There's a lot of ways to get involved.
And also, we have also Sam from Princeton.
Yes. So we have a front desk volunteer
right?
program for college juniors and seniors who are looking to get some experience in an actual health center, because that can be really difficult to come by, especially those pre-med students. They're always looking for those volunteer hours. So we do have a program, and we'll be taking on more front desk volunteers for the summer and the fall as well. And there's information on that on our website as well, medinahealthcare.org.
So are we educating people? When I say we, I mean your organization. Or is there education in terms of telling people how they should be eating and exercise? Do you have anything like that?
We do.
And I always use this as an example. When I was a lot younger, back when John F. Kennedy was president, I think I was maybe in the 5th grade or something at the time, we used to have a chart. We come to school. What did you eat this morning? And used to get little credits for it. What did what are we having for lunch today? What did you have for dinner? And they'd have the different food groups and this and that and the other. And then every day, recreation, the morning you'd have something. They'd get out there and they'd let you run. Even if it was running down to the fence and running back again, if it was real cold out or whatever. Yeah. But there was always exercise involved, even in the grade school. And the diet was emphasized, even in the grade school. So that's where it starts. When you do that with a young child, right? Then as they grow into adults, they go, oh, wait a minute, I remember, because I still remember that. If I remember that, I'm not unique. You know what I mean? So why aren't we doing that today? And I'm not saying that, I'm saying that as a broader question, but like your group, I think would serve everyone well if at some point they were able to, create something, like this is what the food groups you should be eating or whatever, and distribute that to people coming in or passing through.
Yeah, and I think there's a big misconception about what primary care is. A lot of people assume it's just writing prescriptions and drawing blood. Right. But really, that's what our provider spends the majority of her time doing in that examination room, is counseling on diet and nutrition and exercise. Let
me just point something out. I got this, as you can see, I used to be a union carpenter for a while, but look at my hands. So I'm full of rheumatoid arthritis. So I would go into the rheumatologist, let's say, and I was, I've been dealing with this for, I guess, going on 21 years now. So, and in the beginning, I was able to overcome a lot of this. I mean, and now I'm a little bit incapacitated in terms of physical mobility. But back in the day, I was able to overcome much of it and able to get myself back into work in another capacity, hence the job with the state and what have you. But I would go into the office and I'd see people sitting there, and they were maybe my age or maybe a little older or whatever, and they looked like they couldn't even move, right? And I'd go and I'd talk to the doctor. Do they know about going to the Y and going into the pool? Swimming is the best exercise. There's no impact on the joints. Yeah. He goes, well, he says, they know about it, but, where there's pain, they have to overcome, the pain. And a lot of people won't do that. They don't realize that if you make that effort and you start to do that, then everything works better. Your muscles are going to get stronger. Your tendons are going to get back in shape. You're going to have a range of motion that's much better. So all that plays into it. So even that, telling people, hey, listen, you have this problem, but, exercise is going to help you overcome it. And the doctors do tell people, some of them, but most
Yes.
people don't listen. They don't push it. They don't drive it home.
So there's just one thing that I would like to say is that, whenever a patient comes to us, we always have follow-up care. We tell them what to do.
Right.
Secondly, I think it's very important to see the context,
Right.
because people are coming in from different cultures with
Sure.
different understandings and ways of being.
Right, that's right.
So I think it's important for us to listen to what they have to say
Okay.
and also suggest maybe you should try doing this rather than saying, no, that's wrong, you should do that.
Right.
So
Yeah,
I think
yeah.
if what fits into one's understanding and perception,
Right.
they will
Right.
have that. They will do that more regularly in their lives.
Right. Well, anyway, we reached the top of the hour, and I want to thank everyone here for coming. And
Thank you.
And
Thank you for having us.
all the people that are involved in your organization. Mira, you've been very helpful in providing community service, along with
Yes, it is.
your colleagues here. And my colleague Bill over there, sitting there, once in a while, he comes out of the gallery there with some good
Out the
ideas.
starting gate, I go.
Yeah. And I want everyone to remember, until the next time.